Welcome to the She Found Motherhood podcast. Today we're lucky enough to have Carly, a nurse who had a lovely little baby boy, Noah, about 7.5 months ago, join us to talk about her experience. Now, she had a couple of miscarriages and really struggled with anxiety throughout her pregnancy and postpartum. She talks about her journey and what she wished she had done a little bit more effectively to help manage her anxiety, mostly just to talk about it and recognize she wasn't alone. We also talk a little bit about how she wished she prepared for her birth experience a bit more effectively. We talk about having a birth plan or birth preferences and prenatal course. So we'll chat with Carly just after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Carly, thank you so much for joining us today on the She Found Motherhood podcast. We love birth stories, and I'm really excited to hear about your experience with young Noah, who I think is about 6-ish months old at this point, give or take, maybe 7.5 by now, because it took us a little bit of time to coordinate this. But I would love to hear about your experience. But why don't we start off by you telling us just a little bit about who you are?
My name's Carly. I live in Victoria, British Columbia. I'm a nurse here on maternity leave currently, and I'm originally from Nova Scotia. So I definitely like the coastal life.
Yeah, we were chatting that a little bit. My husband's from Nova Scotia, and I went to Dal for my undergrad. I know the area-ish. Didn't spend a lot of time there, but it's a beautiful area. Oh my
It
goodness.
really
The weather in Nova Scotia is amazing for 2 months of the year, and then the rest of it is horrible. But otherwise, it's such a great place. Similar to the island-ish, but we have better weather.
we do. I definitely do enjoy it here a little bit more.
So why don't we start off by, if you don't mind, telling us a little bit about your journey to get pregnant? Because I know you had a few challenges. So why don't you tell us a little bit about that journey?
Yeah, my husband or my fiance and I had decided to try and start having a baby through the pandemic. Our plans got put on hold and we thought, why not? Some people have some trouble. We didn't know where we would stand. We got lucky and ended up getting pregnant the first time we tried, unlike some others. And we miscarried our first one. That was difficult, but I knew it happens. I struggled with, okay, this is common and this also hurts. So we tried again. We were told there doesn't seem to be any complications or anything. It just happens. So we tried again right away. I got pregnant again and happened to lose that pregnancy as well. So it was a bit of a hard time. I, of course, want answers to everything. That's just who I am. I applied to the UBC recurrent loss clinic, but happened by the time I got in, was pregnant again, which happens to be Noah's pregnancy. So being pregnant for the third time within a 4 or 5 month time span was definitely something I didn't think through too much, the grief that sort of carries with that. But we were super excited and just started that journey. But yeah, it was a little difficult at the beginning for sure, just with all the feelings around it and the anxiety that came with waiting. Is this going to stick? Are we going to lose this too? But yeah, here we are. We have a 7.5-month-old.
That's awesome. Thank you for sharing. And it's incredibly common, but that doesn't mean it's easy. Kind of miscarriages. And you're right, 1 or 2 is very typical in many people's kind of reproductive journey, but it doesn't make it any easier. And it's important to take the opportunity to grieve that loss, although many of us don't. We just rush into the next one because we think that will cure our sadness. And sometimes for some people it works out, but for others it comes back and bites you in the butt, so to speak. And those feelings, if they're not managed and dealt with, can come back. So how did that affect your pregnancy?
Oh my. It just started off with a lot of anxiety. Thankfully, I had a really great physician who happened to give me like an ongoing blood work to go get checked every 3 days to make sure the pregnancy was progressing. Like I said, I'm someone who wants to know things. So I wanted to know if it was going south again or if we were doing well. And so I was really thankful for that. Eventually, we hit the 12-week mark and I sort of just waited for all those milestones. Like, okay, we made it 12 weeks. Next one was, I think, 20. And then, of course, it was every week after that. My husband also had a hard time. I think we always think of mothers and stuff, but I definitely noticed with him, he was just as anxious as I was. And every week would just be like, what are the odds of him surviving if we were to give birth now? So, yeah, just full of anxiety. Didn't think about that at the beginning, trying again right away. But, we are thankful we did 'cause we have Noah. But it was, yeah, a bit of a journey.
Now, it sounds like both you and your partner had quite a bit of anxiety during that time. Did either of you reach out to counselors or how did you manage that? I know a lot of people just push through it and don't reach out for support. What did you do during that time?
So I went to counseling, and I really wish, looking back, we had gone to couples counseling or at least brought him with me because it was more so me going to counseling than coming home and telling him how it went instead of him also attending and us working through it together in that sense because it was definitely a difficult time. I ended up getting really sick also, unfortunately. And so he had to carry a lot of the weight of the household on himself. And that also played into a factor of it too. Yeah, definitely wish we had both gone, not just me.
Yeah, and I think you're really right in that statement. We often focus on the pregnant person, and partly in our system that's set up because the pregnant person is our patient, whereas the partner often isn't, unless you're seeing your own family doctor who cares for both of you. And I think we really need to do a better job of focusing on the family and caring for the family as a whole unit. And we often forget that or don't recognize or our partners need support too, but they often, I think, feel that their role is to support you because you had the pregnancy loss, but really you guys as a couple lost the pregnancies and deal with it in different ways.
Very different. I really need to talk about it, and he kept it all inside. And so watching that go down, I was like, "Oh my gosh, we are so opposite right now. Like, we really need to come together here." And that's a challenge. It doesn't happen overnight. It took the whole pregnancy, the whole 9, 10 months to really come to that place.
Yeah, and I think sometimes it's hard to recognize that your partner is grieving because they do it very differently than you.
Exactly. He totally went through that.
Yeah. Yeah. And respecting each other's way of grieving. But unless you talk about it and can communicate about it, it's hard to recognize that, right?
It is. We never seen that side of each other before. So going down that path, and it's felt very separate for a long time. It was a battle of me saying, I need more support from you. And he's just like, I'm so empty. I'm lost. I don't know how to give you anything because I'm scared to get hurt again. So yeah, it was definitely a battle there for a bit.
Thank you for sharing that. Sounds like the rest of your pregnancy went pretty smoothly.
For the most part, yeah, there was never anything too scary. I ended up getting HG. So I had this idea of having a fit, healthy pregnancy. It was healthy. I just didn't get to eat very healthy. Definitely lived off toast and peanut butter there for a good almost into the third trimester. And yeah, that's how that started off. I lost a bit of weight at first, but thankfully got that back on and some. And yeah, I had an irritable uterus at 21 weeks and ended up going off work after that because they figured it was probably stress induced. So then I found myself nauseous sitting at home on the couch. What am I going to do? Would have been a great time to get the nursery together and such, but we were in the process of building a house. So we're in a run. So I sort of twiddled my thumbs and decided to draw out of a nursery to get ready. But definitely looking back, I wish I had used that downtime a little bit more productively and like getting more prepared for bringing baby home and what to expect. Cause I definitely got a little nervous. I think the last week I really wanted him out, but I was like, I don't know if I have everything together or ready. So that was that bit of things.
So not so smooth a pregnancy. Hyperemesis gravidarum, feeling that morning sickness, all day sickness for most of your pregnancy. An irritable uterus, going off work, and building a house. That's a lot.
Yeah. It was a lot. Yeah. At the time, it was definitely very stressful. I think I look back now and don't quite remember it as heavy as I did at the time. But yeah, it was a lot. Definitely the irritable uterus scared me, always feeling like you might go into labor eventually. So when I finally did go into labor, actually, what was I saying? Look at me go here. Did I say I was
No, you're
going
just
into
talking
labor?
about you were scared about going into labor, and then you actually went into
Oh,
labor.
I'm so sorry. Yes, I went into labor on my due date, unlike most people. So I really wanted him out. I tried so many things to get him out early. That didn't work, but thankfully, right on the due date, I went into labor. And I had contractions for about 3 weeks that seemed to come off and on throughout the day, usually at the same time every day, which was really funny. But when I actually went into labor, I could not tell if it was just the irritable uterus acting up or if this was the real thing. And kind of funny, I went through my text messages with my fiance the other day, and I had seen when I texted him, "Hey, I think you should come home now. Things are getting, more real." He's like, "Oh, I'm sure you'll be fine for a bit." His replied back, and we didn't go to the hospital for about 5 hours after that because I just didn't know if that was truly it. I had gone in a few other times with just some minor concerns like, am I in labor now? Am I not? And I didn't want to do that again because it was embarrassing, which it's totally normal. I feel like so many people do this. But to me, I was like, I really want to go in at the real thing. So I went in and I was 8 centimeters dilated. Yeah.
Well done, mama.
A lot. I remember we were on our way there. I was like, "Oh, I really should have went in earlier." But yeah, once I got the epidural, things really slowed down. I didn't mind that because they gave me some medication, and along with the epidural, it was the best I had felt my whole pregnancy. I just sort of laid there all night and enjoyed it. I couldn't sleep because I was so excited, but yeah, that's how that all started. And I'm really glad that I did have that time to just relax and get me into a bit of a better headspace to give birth as opposed to this 9, 10 months of anxiety. So I was very thankful for that.
Good. I'm glad that worked for you. So, how did the actual pushing and giving birth go? How did that tell me about Noah's first foray into the world?
You know what? I actually had the best birth experience. So I was really thankful for that, just having a bit of an up and down pregnancy. Yeah, that was the one thing that went really well. I ended up going to a pelvic floor physio a few times before I actually went into labor. But the appointment that I had booked to learn how to push properly, of course, was on the day I ended up going into labor because I just thought he would be late. So I didn't get to go through that. But it was really great. My doctor, I think there was 3 other births going on at the time, and so the physician was very busy. So the nurse actually was a midwife in another country, and she was really great and teaching Jonathan, my partner, what to do and how to support and getting baby out. It went really smoothly. I think I pushed for an hour and 20 minutes. And yeah, I really wish I had learned how to push though, because I ended up throwing my back out. So, once I learned that happened, that was a little painful a few days after that.
Yeah.
Yeah, it went really smoothly. He came out. He didn't cry at first, so I was a little nervous. I was, of course, waiting for those cries, and yeah, he came out eyes wide open, and I could not believe it. I sat up and looked at him. I was like, "Oh my goodness, here we are." And yeah, he is the sweetest little guy to this day.
Lovely.
Yeah.
That's awesome. Did you go skin to skin with you? Did Jonathan cut the cord?
Yeah, he went skin to skin. I think John cut the cord. That's super funny. I don't know. I think I was just so excited. I remember I told him to. I think one of the things looking back, I didn't go in with a birth plan because I tried to not control my whole pregnancy because I had learned I could not control any of it. And so I thought if I tried to plan it, it might not go in my favor. And I don't want that disappointment, but I do wish I had planned a little bit and had a few more of my, I guess you could say, like wishes known to everyone because I went into it thinking that I was going to birth my placenta. And so, of course, once Noah was on me, I was like, okay, guys, let me know when I have to push again. And they're like, oh, no, your placenta's already out. So that really shocked me. I had no idea. And I really wanted to see it. So, of course, I was like, hold it. I need to look at this. So that was a neat experience. But I came with a bit of a story afterwards that I'll tell you about. But yeah, it was pretty great.
Yeah. Yeah. And we have a birth preferences, we call it, instead of a birth plan for exactly that reason. So it gets people thinking about what their wishes would be in situations and when they would accept certain interventions, just to get people thinking about it, but not like you're saying stringently planning. But you're 100%. We have no idea how things are going to go. And so it's just a bit of a get to know your pregnancy and start having discussions with your partner and your care provider. So we'll put that in the show notes if anybody's interested in doing that. And it's free, and we have actually a free little mini course on how to fill it out. So we'll get that in because I think you're so right. You don't want to have a stringent plan because if it doesn't go the way you expect, then there's disappointment involved. But it's good to have a sense of kind of what you're thinking and for your partner to know so they can advocate for you and so you can have those discussions with your care provider too.
Totally. I remember actually thinking of your sheet that you had afterwards, and I was like, "Oh my gosh, I should have printed that out, Carly." I was like, "Why didn't you do that?" But definitely next pregnancy. But yeah, I think I got a second-degree tear, so I was pretty happy. I was going into it with my headspace of, "Okay, if I need an episiotomy, like, it's gonna happen. It's fine." So that was my one thing. I was like, "Okay, Carly, prepare for that." But yeah, that's where we're at.
Awesome.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
So how did things go after delivery? How did those first few days to weeks go with Noah?
So right afterwards, he latched on to my breast right away, but that ended up being a very painful experience for me. And that was a bit of a struggle because the one thing I really wanted to do was breastfeed him. And I was pretty hell bent on it. I wish I had been a little bit more flexible in my mindset with that. So I ended up staying in the hospital for almost 4 days after due to my back pain and really wanting to see a lactation consultant. Sometimes they have a nurse who's certified and will circulate. So that was great, but I did wait a few days for that. I was scared to go home without it and just having that extra support. I really wanted it. So I ended up using, what do they call nipple shields for probably 3 to 4 weeks until we got that pain under control. And he ended up seeing a lactation consultant in the community just to make sure he didn't have any ties. There wasn't any other concerns going on. So definitely breastfeeding was a bit of a journey. And he ended up also having we think, dairy allergy. So I cut out dairy. So there's definitely been a few things with breastfeeding there that occurred. And he didn't tolerate at the time anyway, when he was a newborn, the hypoallergenic formula. He didn't quite tolerate it as well. He's very, crying most of the day and night. So we chose just to breastfeed and push through that. So breastfeeding was definitely a challenge right away after. I think it was about 8 days postpartum. I had a delayed hemorrhage. It was about 6 in the morning and I was nursing him and I thought I peed myself and I couldn't believe it. I was like, oh my goodness. I was like, I did not expect that. Like, thought I had my pelvic floor under control here. And I stood up and it kept coming. I was like, okay, I don't think this is urine. And I yelled for my partner and went to the hospital. And I was in there all day trying to make a plan to get that under control. Hemorrhaged in the hallway on my way back from medical imaging. So it was definitely scary and traumatic. I waited 36 hours for a surgery that I didn't end up getting, which I didn't really want the DNC, but I knew if I had to get it, obviously it's my health. I'm gonna go with it. But the surgeon that came on, she was lovely, and we made another plan and tried misoprostol, which ended up being effective and working. But yeah, that was definitely an experience I was not prepared for. Our family doesn't live here, so the support system, a postpartum for us, I had two friends, really close friends, and without them, I don't know what I would have done. I'm definitely not the type of person to ask for help. My one friend was like, I've been there, I have two kids, like, you need to ask for help, Carly. And I really wish I had took that advice a little bit more because I definitely asked for help at like the last possible, second minute, my breaking points. Yeah, I definitely wish I had asked them to even be around during the good times a little bit more. Like, hey, why don't you come over on a Thursday evening and I can shower and we can hang out, just to have someone there other than just putting everything on, John and I too, because he also needed that support. It wasn't just support mom. But yeah, that's sort of how the first few weeks after went. He eventually didn't cry as much once I cut out dairy fully. We're 7 months into it now. I've tried a few times to have some cheese and stuff. It definitely doesn't sit well with him. His symptoms have changed over time though. So I'm hoping eventually it's something that does go away. But breastfeeding has worked out now. And yeah, everything has turned out positive. But in the moment and at the time, it was definitely difficult. There were some hard a few weeks for sure.
Yeah. My first had cow's milk protein allergy, and it's hard. And I think he grew out of it around 9, 10 months. And then my second had reflux, which can be worsened by dairy. So I know your struggle.
It
I
is
know
just,
your struggle.
I wish I had more knowledge of it beforehand. I didn't take a prenatal course. I know you guys have one, and that's definitely something I would do next time is definitely put more knowledge into myself about pregnancy and postpartum and how to prepare for just the little things and those pieces of information that you just wish you had
I
looking
think the
back.
nurses generally are pretty good at the hospital about what to expect postpartum, but then you forget it because you're in this state of no sleep. And so in our course, it's all pre-recorded so you can rewatch it. So a lot of our patients say, or the people who buy it are like, oh yeah, I went home and then I watched all of the newborn and postpartum one over again once I realized what you were talking about. Because it's hard when you don't really know what to expect, like, and you don't have a baby in front of you to take that in and really listen to it. So having that opportunity to re-listen can often be really very helpful.
Oh, totally. And like the support I had on the unit was really great. I remember my day nurse, it was like with breastfeeding, I couldn't be full enough. I really needed lots of food. And no, they were so lovely. And I was there quite a few days. I got to know quite a few of them quite well. And yeah, no, they do give you lots of information, but it is almost overwhelming at the time. And of course, I then threw it on Jonathan. I'm like, you have to remember all of this. And he was definitely taken aback by that and all of those things.
Yeah, for sure. Hey. So, love to talk to people about what is their most memorable, positive moment. What did they struggle with the most? And if you were to do it again, what advice would you give yourself going back into it?
Definitely my most memorable positive moment was when Noah was born and they put him on my chest. That was something, it's a feeling I did not expect to have. I was preparing myself like, okay, not everyone, gets that connection, Carly. Be prepared for that. But it was a life-changing moment. Yeah, you're a mom the second they put that baby on you. And it was just so surreal. I had pictured it, imagined it, and wished for it for a really long time. And yeah, it was just pretty incredible. The most challenging Was that the next one?
Yeah.
Yeah. Oh, my mental health for sure. Through pregnancy, second trimester was probably the worst for anxiety. I would find myself, just watching TV and I would get a panic attack. And that was not me. Before, we have a lot of hormones and stuff going on when you are pregnant. And managing that, I was not prepared for. And I tried certain things. I had some support set up, but I wish I had taken care of my mental health maybe pre-pregnancy a little bit more, just in the fact that I lost a lot of my coping mechanisms from having HG and the irritable uterus. Going for a walk wasn't happening. And so I wish I had have just tried to find other activities instead of just sitting on the couch feeling bad for myself. I really wish I had just got up and sat in my car down at the ocean or something. Something as simple as that really would have helped me. I wish I had gone to therapy a little bit more during pregnancy. Yeah, those were just definitely the most difficult times in postpartum. You're on a high when you first have your baby. There's so many emotions. And about after the first month, I found myself sitting there. Okay, this is supposed to be the happiest time of your life. There's so much joy in this, but I felt empty. I looked at my baby and I was like, I just don't know. I feel nothing. I was like, I don't like this. So I cracked it up at first to, oh, it's just me. I'm not getting enough sleep. Maybe I could be eating better. And I was just making excuses for myself instead of taking control of what was going on. And so I think it was about Noah's, 2-month immunizations that the public health nurse noticed that I likely wasn't doing so great. And she gave me a phone call after I left, and we did the postpartum depression scale. It's a bit of a questionnaire. And she told me I scored high. She was concerned, and that, sort of lit a fire under me that, okay, you know what? If I'm being honest, like I haven't been okay for a while. Yeah, I'm not doing great. I need to do something about this. Went to my doctor and we made a plan. And I ended up going on some medication because I found I couldn't juggle trying to go for a run 2 months postpartum, having all these coping mechanisms. I just really needed to take this head on and get to the root of the problem. And so I upped my therapy. I learned to spend some time by myself and not just consume myself in motherhood, even if it was something as simple as going to get a morning coffee and I did it alone without baby. Yeah, just really taking some more time to care for myself and getting more sleep, allowing my husband to spend some hours with him without me there and pumping and leaving a bottle. And yeah, I was just something I really wish I had realized a little bit sooner that I might need help and support. And I wish the first time I had thought about it, I don't know if I'm okay, if I was questioning it, that should have been my signal to Carly maybe talk about that with someone as opposed to just reverting inward and no, you're good, you're happy, you're fine. Because it's a lot. It's so much of your life has changed and it's a whole new journey and you're learning, a new part of yourself. And having to navigate that alone and internally, it's impossible sometimes.
Yeah, you're so right. And we were chatting briefly before about how we just don't talk about it as much as we should. And I don't know if that's because we, I don't know. I don't know why we do. I don't know if it's because we feel like we're weak or if we're not always happy, then we're not great parents. I don't know what it is, but you're 100% correct. We just don't talk about it enough and we don't reach out for supports enough. And it's so important to reach out for those supports to whomever that is and just talk about it. Because oftentimes that in and of itself is really therapeutic, just recognizing it. And then you realize you're not the only one, because I bet you at least one of your buddies, one of your friends is also suffering and has gone through the same thing and can give you some advice or just a shoulder to cry on.
Exactly. I wish I had talked to it with anyone. I didn't have to be, a professional or someone who you're paying, just anyone. Yeah. And looking back, I actually ended up social media has become community for me. I found postpartum. It was something I stayed away from during my pregnancy, just with the anxiety and fear of losing a baby. It was difficult, but I did find a community in it postpartum. And I could not believe I'm not alone. So many people have been through the same thing, but just also, again, never spoke about it. And I just could not believe it. I was like, I thought this whole time I had some shame around it and that I was the only one and that I should not be feeling this way and that it makes me a bad mom. But finding that support and however you do it really changed the way I looked at it and made it a bit more of a positive experience. I know that sounds strange, but accepting, okay, this is where I'm at and I'm going to make a plan. I'm going to do something about it. Really changed the way I looked at it.
It gives you a bit of control back, right? Where you're in a situation that you often feel out of control.
Exactly. Couldn't have said it better. That definitely sums it up.
Carly, thank you for sharing your story.
You're welcome. Thank you for having me on here. It was so great and actually really almost therapeutic in talking about the whole experience and sharing it with others.
Yeah, really appreciate it. And give that Noah a big old hug for all of us, from all of
I
us. Tell him thank you for he was so well behaved and quiet.
I actually cannot believe he is that quiet right now. He's finding his voice. And so usually it's quite loud in here lately.
Give him a big old high five for me. Thanks again, Carly. Really appreciate the time you've spent to talk to us.
Thank you. Have a good day.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.